Thinking about plastic surgery can bring up many questions, and one of the most important is often about safety. You might wonder, what are the chances of something unexpected happening during or after a procedure, and how do those odds actually stack up? The good news is that for most common plastic surgery procedures performed by a board-certified plastic surgeon, the overall likelihood of serious complications is quite low. While every surgery carries some inherent risks, significant issues like severe infection or major adverse reactions to anesthesia are generally uncommon, typically affecting only a small percentage of patients. The likelihood of specific complications varies greatly because it depends on several key factors. First, the type of procedure itself plays a big role. A less invasive procedure will naturally have fewer risks than a more complex one, like extensive body contouring. Your individual health status is also a major influence. Patients with pre-existing conditions such as diabetes or high blood pressure might have a slightly higher risk for certain issues. Furthermore, the skill and experience of your surgeon and the quality of the facility where the surgery takes place are incredibly important. Lastly, how well you follow your preoperative and postoperative instructions significantly impacts your recovery and your risk of complications. To understand the specific likelihood for your unique situation, the best approach is to have an open and detailed discussion with your prospective plastic surgeon. They can provide statistics for the exact procedure you are considering, taking into account your personal health profile. Ask them about their own complication rates for the procedure, as well as those published in medical literature. This personalized conversation will give you the clearest picture. When discussing risks, your surgeon should categorize them into common minor issues, which might include temporary swelling, bruising, or numbness, and rarer, more significant complications, such as infection, hematoma or seroma formation, or issues with wound healing. For example, general infection rates across many procedures are often in the low single digits, usually below 1% or 2%, but this can vary. Understanding this distinction helps you manage expectations and be prepared for your recovery. Make sure the facility is accredited, which means it meets strict standards for patient care and safety. By thoroughly understanding the factors that influence complication rates and actively engaging in discussions with your surgeon, you empower yourself to make well-informed decisions. This proactive approach helps to minimize potential risks and sets the stage for a smoother, safer surgical journey and a more satisfying outcome.